Hi, I'm Aileen O'Brien. I'm a reader in Psychiatry. I'm just going to talk to you now about how to do an assessment after someone has self-harmed. First thing to say is it's always important to take any episode of self-harm seriously, because people who self-harm are not only expressing distress, but also are at increased risk of completed suicide in the future. So there are various ways to look at this. One is the social demographic factors. There are certain groups who are more likely to be at risk of completed suicide, especially older men. And that especially applies to men who have been divorced, bereaved, socially isolated, live by themselves. There are mental health factors that can put people at greater risk. So although suicide doesn't necessarily have to be something that related to mental illness, the vast majority of people who kill themselves probably do have some form of mental disorder. And the ones that are particularly high risk are depressive illness, psychosis, substance misuse, especially alcohol, and eating disorders, especially anorexia nervosa, personality disorder. Other factors which are worrying are people who have chronic physical illnesses, especially if they're in a lot of pain. Then you'd want to ask about any event itself. So, had the person make preparations before the event? Had they made a will? Had they sorted out their financial affairs? Made efforts to avoid discovery? What do they do? Cut themselves? Take an overdose? If they did take an overdose, what did they take? How much did they take? And crucially, what did they think was going to happen? You may take a minor overdose, but if you thought it was fatal, that's a serious act of self-harm. Violent methods are particularly worrying. So if people use weapons or throw themselves off tall buildings, that kind of thing, it's very alarming and puts people in a much higher risk category. How were they found? How did they come to attention of services? Did they seek help themselves, or were they found accidentally? And then now they are in services, how do they feel? Do they regret what happened? Are they relieved that they weren't successful in killing themselves? Do they feel hopeful for the future? What are the factors protecting them from harming themselves again? All of these strands and threads can be brought together to do a better clinical risk assessment.